as a whole. And so the steps that we mentioned before about individual actions to prevent illness in yourself by having good hand washing and not touching the eyes, nose, mouth, and face, by avoiding contact with ill people, staying about 6 feet away from others in general if you can, and not going to work or school when you're ill, and having a pandemic preparedness plan. And there's some very good resources available for the public on pandemic planning. You can Google CDC NPI, non-pharmaceutical interventions, and get a nice summary of measures that are recommended for individuals, schools, and businesses. There's good business planning that's been issued by the CDC, and there will be, over the next couple of days, additional specific guidance coming out around pandemic planning. But it's basically be prepared at home, be prepared to take care of those in your home who are ill, and those who might need special care, older adults or people who have special needs. Understand what you'll do if someone's sick and can't go to school or work, how you'll manage in the home. Have neighborhood support. Know your neighbors and what your community organizations can do for you. That's incredibly important as well. And for all of our businesses, start thinking now about how you can reduce the contact that your employees will have with one another over the coming weeks to months, should we need to ask you to do that. So telecommuting, distance meetings, minimize face-to-face gatherings, and we will also be considering...
Hey, what's up? This is your girl Nicole Reloaded. Excuse me. Forgive me. You're gonna be... Oh, wow. I don't have the coronavirus. I just got allergies. Oh, my goodness. As listening to this video, watch live Washington state officials update on first U.S. coronavirus death. This was streamed 49 minutes ago. Washington State Health Department officials update the public on the first confirmed U.S. coronavirus death. Now, it looks like they're preparing us for a pandemic. Now, let's see some of these comments in here. Thank you for coming out and telling us the truth about this virus. I urge all hospital physicians to come on and tell the truth about the virus, no matter what your affiliation. Let's see what the reply says. Everyone gangster until this guy coughed, just like the Iranian guy, right? Be prudent, okay? Yes, I know. That's, you know what? Camilla T says the doctor doesn't look well. And the first thing he did before reading his update was cough. And not into his elbow. What the F? OMG, coughs in hand. Oh my God. Supposed to cough in elbow. The person who died first, it was a 19-year-old male, then a woman in her 50s, now a male in his 50s. Yeah, I trust you. Don't listen, fool. You get the virus, you take care of yourself. If a person in their 50s, not sure if it's a man or a woman, coronavirus rarely kills young people unless they have existing health conditions. Deaths are overwhelming old. A fact not verified around the world. Men of age of coronavirus deaths in China is 75. Trump might actually be willing to pull his head out, not a Democrat hoax, as he claimed the other night. Look, everybody, please be diligent. Follow these doctors' rules. Get you some bleach. Lysol, mask, stock up on water, antibacterial soap, baking soda, bleach, lots and lots of water. Just get a bunch of disinfectants, antibacteria. This virus is fungal. Now, I skipped back a little bit because I wanted to reiterate on this. Please, in the name of Yahshua HaMashiach, share this video. Knowledge is power. I know that it's long, but this is important. The Bible says, my people shall perish due to the lack of knowledge. We have to step our game up. There's more information that I'm going to be providing you guys too. Okay? I'm doing the best that I can. Please like, share, subscribe, and all that good stuff. Listen, get multiple cans of Lysol. Have Lysol in your car. Spray yourself when you get in. Spray yourself when you get out. Have a can of Lysol. You can get the travel size and put it in your purse. Put it in your pocket. Okay? There's another thing that I wanted to tell y'all to get, but I can't think of what it's called. Anyway, we'll finish listening and I'll provide you guys with some more information. This is your girl Nicole Reloaded, and we loaded up with a real video.
Things like cancellation of large public events if we see more evidence of spread in the community. But at this time, it's really important to understand this is a focused event in one long-term care facility in one region of the county, and at this point, we're not asking for large-scale, cancellation of public gatherings. We're asking for personal responsibility. Get informed, don't panic, get prepared.
Dr. Duce, can you talk about the criteria for testing? It used to be if they had traveled to China, things like that. Now, obviously, those have to change because we're getting so many cases where these people haven't traveled.
Yes, so testing capacity is still limited, although we're...
Also, that what came to mind, this virus is also called, I can't think of the name of it, what it's called, but the coronavirus came through a snake. Snakes eat bats. And in Wuhan, they had a livestock, okay, where they sold animals, possums, cats, dogs, you name it. And people down in Wuhan were eating these animals, okay? Snakes were able to harbor the corona man-made disease, okay? I'm going to be dropping some stuff in here, so y'all pay attention to this video. I'm going to be dropping some things in between, in and out. Pay attention. Use your brain. This was a man-made virus to kill African American people and to depopulate. And it also was created as a biochemical weapon. I hope that I said that correctly. I don't have my notes. But I believe biochemical. Okay? It's a weapon. It was created in China. And there's many more. They don't want to drop bombs on us. They want to depopulate. From what my research tells me, down in Wuhan, down in China, is where it was tested and it was leaked. They wanted this virus to spread to Africa. Now, this is no disrespect to any other nationality. Okay? So please don't take it in that way. But this virus, from my research, no, I am not a doctor, nor am I a nurse, a therapist, or any of that kind. I'm just giving you from my research, from what other doctors, nurses, people in the health community, down deep down in these secret blogs that keep getting shut down. You know they like to hide the truth. They wanted this virus to spread to Africa and kill people. Think about it. If you have noticed, and have been doing any reading up on the coronavirus, there's 2 drugs that can strongly help get rid of this disease. And they're both HIV medications. Oh yes.
Very grateful that our Washington State Public Health Laboratory is now testing locally. There's still a limit to how many tests that one laboratory can run, and so we're hoping to have more testing available in the community in the coming days to weeks through commercial laboratories, perhaps through university laboratories. But at this point, we follow the CDC's guidelines for testing. They have criteria, so if you've traveled to an area where there's community transmission occurring and you've got certain symptoms, you can be tested. And if you've got severe illness, such as our patients at Evergreen had, even if you don't have a history of travel, you can be tested. And that's how we uncovered the local cases, by dropping the travel criteria and testing patients who had an illness that was serious.
Can we talk about those first responders who may have transported that 70-year-old to Evergreen or responded to that care center in the last week or so? We've heard there's been some quarantine done with some of those firefighters, Kirkland, Redmond. What can you tell us about your recommendations?
We follow up on all persons who are exposed to known confirmed COVID-19 cases and do a risk assessment to understand whether they're symptomatic, have symptoms that might be worrisome, require isolation, or asymptomatic, feeling well, and can self-monitor their health for 2 weeks. With respect to the healthcare worker...
Is it just me, or does the doctor look like something ain't right with him? Or am I just being paranoid? What's up with you, doctor? You did cough. What's wrong with you, doctor?
That, and this is not unique to, first responders, but even in our healthcare facilities, patients sometimes may come in and not be recognized as possible COVID-19 patients and then later be found to have the infection. And so what we do is we work with the healthcare facility or the first responder agency to understand who was in contact with those people. We connect with them or have their agency provide guidance around symptom monitoring and what steps to take should symptoms develop.
You said you can do it locally now. Does that mean that CDC no longer needs to sign off for these things? And could you describe the backlog?
Sure.
And how big the backlog is?
Sure. So we started testing in our state public health laboratory just yesterday and are gearing up our team to be able to test specimens around the clock 7 days a week. As Dr. Duchin mentioned, our capacity will be limited at some point. So that's why it's so important that we really can help to get some of these commercial labs doing testing. We are going to, we do have the authority now to decide what we want to test and what we don't want to test. We still are largely following the recommendations from CDC as to who to test, but if we have extra room to run additional samples, we're going to be doing as many tests as we can.
Dr. Lopi, how many tests have you done?
Oh, and we do not have a backlog right now. I don't know exactly how many tests were run yesterday. We have no backlog. We tested we're able to keep up with all the specimens that are coming in at this point.
How many can you do?
Yeah, so we are working up to testing about 200 specimens a day. That is our plan, and we hope to be at that capacity soon. As should we start to see more spread, we will need more testing capacity, and also that's why we're also working very aggressively with some commercial labs too to make sure that there are other labs that can test as well.
Remember this, my people, my insomniacs, wake up. Remember, if you stay ready, you don't have to get ready. And if you made it down this far into the video, I want you to know that you actually watched it. So, the word or words to place down in the comment section that I know that you have watched this video, stay ready. So you don't have to get ready.
What triggered the state or the county's decision to cancel large public gatherings? Could you explain the other authorities that might come into play if transmission were to spread, curfew, quarantine, etc.?
Yeah, that's a good question. And we actually have a whole team at the Department of Health that's now really thinking about these questions. They're hard decisions to make, and I'm just going to be frank with people. If we get to the point where we have to cancel large events, close schools, these are not, insignificant, measures to take. So we are really putting our best brains together to really think through, what are the things that we need, what are all the things that we need to consider? And some things that we would consider are, first of all, how widely is the disease spreading? How much activity is out there? We have a lot of data systems we use to monitor influenza in our population. that we can use to monitor, that we use to monitor how many people are coming in with who are being seen in emergency rooms and urgent care centers with fever and respiratory symptoms. So we have data sources that we can look at. We'll now have more testing, as we talked about. Other things to consider, we're learning more about the severity of the illness every day, the transmissibility, and then there are a number of other things to consider, like our healthcare system. Is our healthcare system able to sort of keep up with patients who are, coming in and need to be seen? So that's just another consideration as to when we might, recommend some of these community-based social distancing strategies. But all of this is really being, really thought through right now, with working really closely with a number of our elected officials.
Any indication that there's any connection between all of these cases in this facility and in the Kirkman area to the teenagers who we were told about last night?
Oh, the teenager from Snohomish County, we are not aware of any connections between these patients at this time.
Dr. Rito, a follow-up question for you, please, regarding the individual who died. Can you tell us more specifically about his underlying conditions, or perhaps where he came from?
The individual, someone with a significant number of comorbidities. He was a chronically ill person. It was a man, and beyond that, I'm going to respect the privacy of the family and the patient. But it was somebody that had underlying risk factors for severe disease. It was one of the things that prompted us to test him because of that. We felt he was at a higher risk and had an unexplained respiratory infection.
Come in at the same time as the woman came in from the care center? Were they connected at the hospital at all?
At the present time, we do not see a connection between the two, but there are some evolving threads that are being investigated.
Doctor, is his family now being told to quarantine? Were they caring for him prior to him coming to the hospital?
The family is aware of the diagnosis, and the family has been counseled on appropriate measures, and they're being followed up as contact tracing, and appropriate measures will be taken in conjunction with Seattle-King County Health Department.
Doctor, this healthcare facility, were they taking the full precautions?
So basically, yes, quarantine.
This outbreak.
I'm not sure which healthcare facility you're speaking about. I can't speak to life care.
Did you guys talk about the fact that yesterday morning there were no King County cases, and now there's 4 the death and possibility of dozens more, and what we're
So that's a great question. I'm happy to address it. What prompted us to start looking is a change in the testing criteria. So the Centers for Disease Control had recommended testing only for individuals who had a travel history or a known exposure to someone with COVID-19. Tuesday or so of last week, the testing criteria changed, and there was a line that included testing for individuals with severe respiratory illness, no other explanation, and no...
Let me say this too. That's what I forgot that I was going to say. This can be transferred once again, you guys. Remember, animals. I wonder, can it be transferred through birds? Birds fly all around. With climate change, you never know. Birds could have got the heck up out of Wuhan, up out of China, and said, "Buck it, I'm about to fly my butt all the way down here to the United States." Look at all those bats and stuff that was boo-booing. What was it, down in, I believe, maybe in England or somewhere like that? Forgive me if I got it wrong. And they were boo-booing all over these people, and they were telling them not to, it's illegal to kill the bats. I mean, how far can these bats and animals travel? Just food for thought.
History of travel. So it was on that basis that we opted to look at 2 of our most critically ill patients in the critical care unit and to initiate a testing algorithm. That was started on Thursday night. The tests were sent out yesterday. We're very grateful for the Department of Health, who now has the testing capacity here, rather than having to send it to the Centers for Disease Control in Atlanta. And with that information, we were able to gain the rapid response. I think the fact that there are patients now being identified locally has to do with that increased testing capacity and the change in the definition for who can get tested.
So it's possible, though, for like the last month, there's been dozens of cases that we just haven't known about.
I think like anything, what we're seeing is the tip of the iceberg. So we're seeing the most critically ill individuals. Usually that means there's a significant percentage of individuals of less severe illness floating around out there. And yes, so in all likelihood there is ongoing low-level transmission. We don't have the epidemiologic link to figure out exactly how these individuals were infected.
Doctor, what are you doing to prepare at the hospital? Do you guys now have some sort of a quarantine area for somebody who shows up and says, I feel like I might have this? Or, I mean, what are you doing to keep those people separate? Have you done any actual changes at the hospital?
So we have engineering capacity at the hospital to turn half of our critical care unit into an airborne precaution center. So basically by reverse engineering airflow, we can isolate an entire portion of the critical care unit. The individuals that are under investigation are currently cohorted and are all in negative flow and airborne precautions.
Dr. It said that there are additional test results expected later today. Do you know approximately how many those are, and are those all patients at your facility?
We have a number of tests that have been submitted, and we will continue to submit.
If they ever ask about me, tell them I was more than just a great set of boobs. Nicole!